Story 3, Bubble Boy. This is a sad story. David was born in 1971 with a severe combined immunodeficiency, SCID, one of the most severe types of primary immunodeficiency syndrome. He lived in a special germ-free bubble from birth. When he was 12 years old, he received a bone marrow transplant from his sister, hoping to restore his immune system. But he developed Burkitt's lymphoma after the transplant and died because of the cancer. Later, his sister's marrow was found to contain Epstein-Barr virus. The virus seems to be latent in a healthy person, but could induce lymphoma in a SCID patient. Now, let's get to know this virus. Epstein-Barr virus, EBV virus, is a member of the herpes virus family. It is one of the most common human viruses. The target of EBV virus is B cells. EBV virus can cause infectious mononucleosis, African Burkitt's lymphoma, Hodgkin disease, and nasopharyngeal carcinoma. Transmission. EBV virus spreads most commonly through body fluids, primary saliva. Infectious mononucleosis, also known as kissing disease, is a very common condition caused by this virus. Most people get infected with EBV virus sometime during their lives. Children are usually asymptomatic or have mild symptoms. Teenagers and adults are at risk for infectious mononucleosis. By adulthood, 90% to 95% have been infected with EBV virus, most probably when they were 5 to 25 years of age. Infectious mononucleosis, also called IM or mono, is primarily acquired through saliva. The initial symptoms of mono are a general lack of energy, malaise, loss of appetite, and chills. The most common signs are fever, a reddened throat, and tonsils, along with swollen lymph nodes in the neck. Diagnostic tests. The diagnosis is made mainly on clinical grounds by history and examination. Blood tests can show some typical changes, such as a moderately elevated white blood cell count with 50% lymphocytes and 10% or more atypical lymphocytes, the mononuclear cells. By the end of the third week, the monospot blood test is positive in about 90% of patients. This is not too specific, as chickenpox, lymphomas, and influenza can lead to a falsely positive monospot test as well. The EBV virus antibody test is specific for EBV virus infection. Even after the monospot test becomes negative, the EBV antibody test stays positive for the rest of the individual's life. Mononucleosis-like syndromes can also be caused by other viruses, such as CMV, HHV6, and HIV. Prevention and treatment. There is no vaccine to protect against EBV virus infection. No kissing or sharing drinks, food, or personal items, like toothbrushes, with people who have EB virus infection can prevent the transmission. There is no specific treatment for EB virus. Let's look at the story of David again. The EB virus can be latent in B cells. This DNA virus has the ability to transform B cells. This could explain why EB virus is associated with malignant tumors, such as lymphoma, Hodgkin disease, and nasopharyngeal carcinoma. Immunosuppressant treatment after the bone marrow transplant also put David at high risk of developing malignancy. So far, we have gone through HSV, VZV, and EBV. All of them are herpes viruses. Latent infection is a hallmark of herpes viruses. HSV and VZV are latent in neurons, and EBV is latent in B cells. Herpes viruses are large enveloped DNA viruses. The family name is Herpes viridae. Members of this group have some features in common: virial morphology, basic mode of replication, and the capacity to establish latent and recurrent infections. The common properties of herpes viruses: similar structure. The virion is spherical, approximately 150 to 200 nanometer in diameter. The genome is linear, double-stranded DNA. The core is surrounded by an acyl deltahedral capsid. This capsid is enclosed by a glycoprotein-containing envelope. Attached to the capsid and in the space between the envelope and the capsid is the tegument, which are viral proteins and enzymes that help initiate replication. Viral culture. Human herpes viruses replicate in human diploid cells, and inclusion bodies or multinucleated cells can be formed, such as RI inclusion body and Tizanc cells. Type of infection. Types of the herpes virus infection include subclinical, apparent, latent, and congenital infections, and integration. As we have mentioned, the hallmark of all herpes viruses is a latent infection. Human herpes viruses, HHV. The human herpes viruses are grouped into 3 subfamilies on the basis of differences in viral characteristics and the pathogenesis of the disease and manifestations. Official names of HSV1, HSV2, VZV, EBV, and CMV are HHV1, 2, 3, and 4. HSV1 and 2 and VZV are latent in neurons and are members of the ARF subfamily. EB virus and HHV8 are in gamma subfamily, and HHV 5, 6, and 7 are members of the beta subfamily. HHV5 is also known as cytomegalovirus, CMV. CMV usually causes mild or asymptomatic disease in children and adults, but can be a serious disorder in an immunocompromised or immunodeficient person, such as a neonate or a patient with AIDS. CMV is the most common virus causing congenital infection. The cytomegalic inclusion disease is a congenital CMV-related problem. Can you recall TORCH, T-O-R-C-H? The C is CMV. I will leave you to review TORCH, pathogens causing congenital infection. CMV is particularly important as an opportunistic pathogen in an immunodeficient individual with AIDS. Although most CMV infections in young adults are asymptomatic, patients may develop a heterophile negative, monospore negative infectious mononucleosis syndrome. The symptoms are similar to those of EBV virus infection, but with less severe pharyngeal involvement and lymphadenopathy. The histological hallmark of CMV infection is the cytomegalic cell, which is an enlarged cell containing a RI basophilic intranuclear inclusion body. HHV6 causes roseola infantum. As the name suggests, roseola is a common disease of infants or young children, in whom several days of very high fever is followed by a rash. 5 classical childhood exanthems rash are varicella, rubella, roseola, measles, and Fifth disease. We have learned almost all of them except the Fifth disease, which is caused by parvovirus B19. Back to the table. HHV7 has been found to cause some cases of roseola. HHV8 is associated with Kaposi sarcoma. We are done with herpesviruses, a group of enveloped DNA viruses with a hallmark of latent infection. Thank you for your attention. See you next time.